Alright, so today I'm going to talk about expressing the bladder of a dog that is down and has issues with a neurological issue, particularly like degenerative myelopathy or DM, or some kind of spinal injury, any kind of neurological problem. What oftentimes doctors won't tell the client is that the bladder, the nerves that innervate the bladder are affected by these conditions. So the bladder, initially what usually happens is that the urine flow is affected. It's affected by the disease, but then also by the fact that they are unable to be stable enough in the back to eliminate all the urine from the bladder. So the bladder just increases in size, and then it gets so large. The bladder is made of transitional epithelial cells, so it will continue to stretch and stretch and stretch. But it gets to the point where, it can't stretch anymore. So it gets so large that they have symptoms of a UTI where they're going really frequently, they can't hold their bladder, and it's because the bladder just can't hold any more urine. And then the bladder becomes affected by this, by losing even more bladder tone. So, my point by this whole story is that when you're trying to express the bladder, you're not going to feel that balloon that everybody tells you to feel for. So, don't focus so much on feeling for the balloon. Just kind of go into the location if you're not feeling the bladder. Just go into the location and give pressure until it produces the urine. So on a dog that's still standing, which hopefully you fall into that category, and he's not, so I cannot get him up, and I'm gonna stretch his little legs back, but I'm gonna be gentle about it, not too far, because I don't want to hurt him. What you want to do is have him, in a standing position. So if you need to assist them, hopefully you have like a help them up harness or something like that, so you can use one hand to kind of hold them up in the back. And then what you want to do is kind of get behind him, maybe if you can, and then go underneath. In the male dog, you just want to go right in front of the penis, and then in a female dog, you're just going to go in front of the back legs, but behind the rib cage, and you're going to interlock your hands like this, and then so you're going to be like this under the dog, and you're just going to lift them like this until just the tips of their toes, like that, are on the ground. And then that should be enough pressure on the abdomen so that they can fully express that bladder. At first they're going to be really, suspicious, and they're not going to like it, but they'll get used to it, and that should help them to fully express. You might have to do it, 2 or 3 times while they're outside, but you'll be able to kind of gauge after a little while, when they're done expressing. For a patient that is completely down like he is, you're gonna want to, I forgot my bowl. So for a dog that's completely down, like Torty is, what I do is express them into a bowl. And the reason I do that is because it's so much cleaner and quicker and cheaper, and he drinks a lot of water. He's on a lot of medications, so there's just so much urine. He gets soaked, This way it just goes straight into the bowl. We can flush it down the toilet, and it's so much easier, cleaner, cheaper. No supplies. So the only difference between a male and a female is the location that the urine comes out. So the bladder is set up the same way. So we're going to be expressing using the same technique. We're just going to, put the bowl in a different location. So for the female, obviously you're going to put the bowl underneath the vulva in the back there. And if you don't want to use a bowl, that's fine. What I would do then is do like an accordion, an accordion peri-pad, and put it right underneath the vulva, going backwards behind her, and that way it'll kind of lead the urine flow away from her and keep her clean. And then I'm going to put the bowl, and I'm actually going to take my sock off so it doesn't get gross. So I'm going to put the bowl under him here, and then what you want to do is just put pressure in the abdominal area, and you can do palms like this if that works for you. That's the greatest way because it's going to cover the largest area. So you're going to do either side of the abdomen, flat palms like this, and just pressure. And you're going to go between the last rib and in front of the back leg here, the pelvis, in this area, and just press and put pressure. You don't have to locate the balloon if you can't find it. Just put pressure in that whole area, and you'll see production of urine. And then the technique that I use is fist, because he's a little harder to express, and then that way I get the bladder fully expressed. If you don't get it fully expressed, then a lot of times you'll get urinary tract infection. And then the dogs that have the neurological issues, after a while, you'll probably start to be able to feel the balloon. If you express, on a regular basis and don't allow the bladder to get overextended, you'll probably be able to start feeling the balloon. So I can feel his balloon now, so that's a bonus. So we'll go ahead and get him expressed. I use the fist method, but I can start with the palm method and see if I can get him done. Yay, I got it. Not very much though. So I'm gonna go ahead and graduate to the fist method. And between expressions, you want to give about 30 seconds. The reason for that is that you need to give the bladder a little time to regain tone so that you can actually get urine expressed. And then I did want to mention that with these guys, if their bladder is too damaged from the disease and it doesn't get enough tone to get them expressed, there is a medication called botanical that you can ask your veterinarian about. So that is always an option to think about, but it should be, it should be a last resort option. All right, let me just go ahead and get him done here. And as always, guys, please feel free to shoot me any questions that you have, because I'm in the same boat that you are, and I am happy to answer any questions if I can. And if not, then I can direct you to, somebody that would be able to, or, your veterinarian who would be able to answer questions for you. Because this is really a hard disease, and you need support. I need support. Almost there, bub. But Torch is having a hard day today. He doesn't feel good. There's a lot of ups and downs with DM too. You know, you think they're taking a turn for the worse, and then the next day they feel better. So that's always, you know, something to think about. I think one more time should do it, buddy. Sometimes with the fist method, I find just kind of changing, excuse him, changing direction of the fist can help get it expressed a little better. And I think that'll work for now. And that is our lesson on expressing a dog with neurological condition like DM. Please shoot me any questions that you have. All right? And if you don't mind liking and subscribing,